Deep breath. Pull your knee up.
Okay, we're here today with Carmelo, and Carmelo is about to start treatment with Dr. Davis. Now, Carmelo, you have bilateral knee pain, so you got pain in both knees. How long has it been like that?
A couple years.
A couple
2 years.
2 years? Was it due to an injury or just aging?
What's the arthritis also? I have RA.
Okay, that's right. You have rheumatoid arthritis along with that. So, so have you seen any other doctors for those knees?
Yes.
And what doctors did you see? The orthopedic or?
Yes.
Okay. And what did he tell you?
That I need a replacement.
Total knee replacement in both knees? Oh, wow. So how did you hear about us?
TV.
You saw us on TV?
Yes.
We're going to make you a superstar today. All right. So your discomfort level today is high because you've already worked your whole day and you've been on your feet in and out of the truck all day long. And your discomfort level today is a number
8.
Number 8. Okay. All right. So we're going to get that pain reduced today after we do our non-surgical operation with Dr. Davis. So this is really affecting your work too, huh?
Yes.
Because you're just in pain and agony by the time the day's done. All right, Carmelo, I'm going to have you stand up for me. All right. Did you have any discomfort when you did that? Where did it hurt? Right there on the outside there on both knees?
Both knees.
On both knees. Okay. I'm going to have you take a couple steps forward here. I want your feet shoulder length apart, so widen your feet a little bit. Arms straight out in front of you. Keeping your heel on the ground. Just squat down as low as you can go. Okay. And that's causing discomfort there. Now, where does that hurt? Same spots? Okay. All right. Let's go up and down the stairs, and I want you to hold on to the handrail there. We're going to go up and down the stairs. Wow, it's beautiful out here today. It's hard to believe it's December. All right, we're going to go back up. All right, Carmelo. So which was worse, going up the stairs or coming down?
Going up.
Going up the stairs was worse? Now, out of all the exercises that we did, which one caused you the most discomfort? Was up the stairs? Okay. All right, you ready to get started? We're going to get you feeling better. All right.
Good.
Pull. Good. Got it. Deep breath. Pull your knee up.
All right. Deep breath in and push. 1, 2, 3, 4, 5, 6, 7.
Deep breath. Pull your knee up. Pull. Yep. 2, 3, 4, 5, 6, 7. Reach down.
All right, we've done our first treatment with Dr. Davis for Carmelo. So let's see what you got. I'm going to have you stand up for me. Any discomfort there?
No.
All right, couple steps forward. All right, feet shoulder length apart, arms out in front. I'm going to have you squat down. Whoa!
Sit down.
Oh, and look at you, did it twice. You couldn't squat before. Oh my gosh. Okay. All right. I got to get over the wow factor here. Okay, I'm going to have you go up and down the stairs.
One step at a time.
Yes. See? Look at that. Look at that. Back up the stairs.
Yeah, no pain at all.
All right, Carmelo. So, what changes have you noticed?
Well, I could walk. I could walk. I could go on the stairs without no pain.
Right.
Yeah.
And you were able to go up and down the stairs with only 1 foot per step. You couldn't do that before.
Right.
And your squat just blew me away.
Right, yeah.
Totally blew me away. Because you could hardly squat before because of the pain. And then you showed off and you did it twice.
Right.
So, what is your discomfort level? We started off with an 8.
I was about 4.
Okay.
Yeah.
So we reduced it by 50%.
Compared to the way I came in,
Yes.
you know, I feel better.
You feel much better?
Yes.
We haven't even done therapies yet.
Right.
So are you happy with your service today?
Yes, I am.
All right. Let's get you out some therapies.
Okay.
Thank you, Carmelo.